At this time, we'd like to welcome our first guest onto the program. I'd like to bring on the program Tanja Madsen, Director of Product Management with HealthFitness. Tanja, good morning to you.
Hi, good morning. How are you?
Good. Great to have you on the program. Are you out in California?
I sure am.
Great to have you coming to us bright and early out there. So give our audience a little background on HealthFitness, please, if you would.
Okay, sure. HealthFitness is one of the leading providers of comprehensive health management and fitness programs, and we've been in the industry for over 40 years, going back to some of the early days of Johnson & Johnson's work, which is where I also started as a health educator. And we just provide on-site staff, screenings, biometrics, health assessments, coaching, and occupational health even.
Well, great to have you on the program. I think the topic for this morning's discussion is very timely. You know, we're just coming off of our major annual IC Forum Expo last week, and wellness and well-being was a big discussion. And, you know, when it comes to discussion around the evolution from wellness to well-being, you know, kick this off by helping us define well-being, if you would.
Sure. Well, what's tricky about well-being is that there is truly no single definition, and that can make it tough because the word well-being is used in many different contexts. But, you know, there's a couple of people who have defined it, and for one of the places we always look is the Webster Dictionary, and they define it as the state of being happy, healthy, or prosperous, which is a really nice starting place to define it in a broader sense. And then also even the CDC simplifies it to say it can be described as judging life positively and feeling good. So we define it as a very broad way of looking at your life, and it is somewhat subjective, because it includes, you know, not only your physical health and how you might feel physically, but then it needs to incorporate many other dimensions of life and health, such as your social well-being, financial, as we were talking about, spiritual, career, community, intellectual, and more.
Yeah. Ron, do you have a question for Tanja?
Yeah, Tanja, flesh that out a little bit more for us, because I think this whole evolution of wellness to well-being is really taking hold in the marketplace, and you mentioned several of them. I always think of you know, the four aspects of the human existence of mental, physical, social, and spiritual, and I'm glad you mentioned spiritual, because that tends to get overlooked. Not religious, because that gets into all sorts of sensitive areas, I guess, but spiritual. And, you know, we're seeing even in that area people dealing with stress and depression in each of these areas, spiritual with yoga and meditation and other aspects, and social with financial stresses, family relationships. What are all the package of services? Can you give us a little bit more in-depth for our audience and our listeners out there of the various ways that you're moving from wellness, which is sort of the clinical health aspects, to this well-being concept, which is much broader, much broader.
Okay, sure, I'd be happy to. And, you know, there are different models of well-being, but the well-being model that we use at HealthFitness really has 5 dimensions that incorporates all those different things that you mentioned, Ron. And I'll start with the physical dimension only because we just can't ignore it. It really is the foundation for where we get our energy and have the physical health to meet both the demands and the joys of living. Hopefully we, you know, even get to enjoy good stuff too. But then when you go beyond the physical, which is very important, then one of the other dimensions that are so important is our social well-being. And that's really about connections and social support. And I think all of us know from our own life too, but human beings need connections with other people. And when we don't have them, studies have even found that lack of social connectedness, like loneliness and isolation, can reduce your IQ and be a predictor of early death and dementia. So that's the, you know, downside of not having social well-being. But on the good side, when you have it, when you thrive and you have a lot of social support and connections, it can be very powerful. Some studies have shown that if you're one of those people that can raise your hand and say, I have a best friend at work, we're 7 times more likely to be engaged, we're better with our customers, we produce higher quality work, and we just have higher well-being overall. So that would be one of the examples of the dimensions.
Okay.
Do you want me to keep going? Because I also don't want to just keep talking.
No. Well, our listeners are here to hear you, not to hear us necessarily. So, yeah, if you got a little bit more there, and then I'll ask you another question about the financial well-being.
Okay, sure. I'll keep going then with the dimensions. The other thing about the social dimension of well-being that I think is fascinating is not only is it important to have it at your own level because, some people are very satisfied with their social well-being if they have a couple of close friends and people that they can confide in and go to for support during difficult times, while other people, like to have a broader circle and busier social life. So I want to emphasize that this is where, again, well-being can be subjective and unique for each one of us. And then the other power of social well-being is our social networks. And we're so interconnected with the people that we spend time with the most every day that Christakis has found studies, and I think you've probably heard of these, that if your friends are obese, your risk for obesity is 45% higher. And if your friends' friends are obese, your risk is 20% higher. So this pattern of how the people that we spend our time with can affect us also is related to not only obesity, but depression and smoking and some other behaviors. So we believe that it's really important to turn those social networks around so that it's positive. So if we could say the friends that we hang out with are in a healthy weight, or the friends that we work with and spend time with are the type who like to go for a walk or eat healthy and do things like that, you're then turning that social power and network into a positive spin.
Are there any sources you would recommend our readers go to, in addition to your website, of course, to sort of get themselves in a better understanding of well-being? I'm thinking, for example, are you familiar with a book called Blue Zone?
Yes, for sure. That's a great one.
Okay. It's a great book to go and read, and it talks about things you were sort of mentioning. It uses terms like, caring circles and sharing circles and wise men and wise women, people who help you along the way with the stresses and depressions of life that tend to make you more productive and happier and live longer. And a high percentage of the population was living above age 100. That I guess it's Peter Buettner wrote the book. So there's some sources like that that work well into trying to support this whole idea of well-being.
Yeah, there definitely are. In addition to just studies that different researchers have done that give you more of the science behind it, like Christakis, you can do Google searches for him. He did that study about the social networks in the New England Journal of Medicine. We also just recently had the Art of Health Promotion Journal, the Wellbeing issue came out by Paul Terry at Hero, and that just came out in January, February of 2016, where there was some really nice summaries done there about well-being and where we are today as an industry. So I think that's a great place to look. And another study that I just call out for people who like to look at how well-being can interact with demographic factors and risk of hospitalization or ER visits is a study by William Gandy et al. So if you do searches for Gandy and that kind of thing, I think you'll find some good stuff.
So how are employers, especially like CEOs, they're so critical in getting the HR benefit manager to move in different directions, but whether it's the C-suite folks or maybe the head of HR, how are they becoming more receptive to these ideas? What's your take on whether it's geographical or industry-wide? How many people and where they start to pick up on this concept of well-being and the broader individual, not just the time they're at work?
Yeah. Well, I think that the time is ripe. Well-being isn't a completely new concept, of course, for people who've been around a long time. There were well-being models early on, but I think they were looked at as a little bit too much fluff. And then even as our industry evolved and we focused on the physical dimension and people started doing research to connect the cost savings and productivity savings over time with those, what happened is now there's enough research there that has proven then the factors that affect many of our physical, blood pressure, cholesterol, depression, things like that, those dots are being connected. And really, money talks with CEOs and CFOs who have to make budget decisions, so you have to always help them see that these efforts are going to help move their business forward. And I think some of the other research that the American Psychological Association has done and some of the consulting groups is they're also helping companies see the connection between well-being and engagement in the workforce. So I don't mean engagement like participating in a walking program, but being a loyal employee who's willing to put in the extra time and effort to make your business move forward, to keep you, really being at your best, And that kind of work, I think, has started to catch their attention because they're seeing that it's really an investment in human capital overall.
So, Tanja,
is there a...
So it directly correlates to productivity, to your point, and performance, which can be two different terms, and to retention, right? A big concern with employers is retaining these people.
Exactly right. Exactly right. And you want to have the kind of workforce that is happy to come to work, has best friends at work. They're willing to go above and beyond and bring their best every day. And if you support their overall well-being, not just their physical, but also their emotional well-being, create a healthy environment and culture, which is also part of the model, then that's when you give them all the support for them to be their best, not only in their own life, but, when they're working for you.
Tanja, can it also be tied back to, CFOs are very concerned about risk management, and the cost of managing, the risk around your employee population. Can it be tied back to helping CFOs and CEOs see that correlation?
Yes. Luckily, there's been a lot of studies out there. Gallup is one of them, has done a lot of research, and you can even connect the dots for them in specific areas. Like stress is a very good one that is, one of the reasons why the financial well-being topic is so hot, because financial well-being is one of the biggest areas of stress, or I should say money issues. There has been so much research done to connect high stress levels with excess costs and, risks of depression and loss of productivity and absenteeism, that would be a great example, excuse me, where, you can connect the dots quickly to some of these other dimensions that we've talked about for a long time already.
And then I think financial wellness and financial well-being correlates to the evolution of more high-deductible, HSA high-deductible plans out there being put in place by many employers. So employees and their families are actually facing more financial risk.
Definitely. We see it all around us, even, in my personal life. That's happened to us with our plans and colleagues and people that I know, and it's affecting day-to-day decisions and on where you spend your money and how you have to plan and budget for it.
Yeah, we've got a couple minutes here to go, and I can't get you off the phone without asking you about something else, and something else. We showcased this last week at Forum, and I just, with your experience, I'd love your feedback on where do you see mindfulness evolving in the total well-being discussion?
I think it's one of the most essential skills that we could learn to make improvements in our overall well-being. In fact, we created a recent program called Beyond Weight, and that's taking a non-dieting approach to weight management. So you take the focus off the scale, but a big part of the skill set that we help our participants learn is being mindful. Because so much of our behaviors, unfortunately some of them are negative coping behaviors, come out of just rushing through life, being overwhelmed, turning to the quick fixes that we have. And if we can pause and be mindful in the present and really accept everything that's happening to us and acknowledge it, and then make conscious choices that, and we can support people and make positive coping techniques, mindfulness to me is one of the really important mechanisms we can use to help.
Yeah, that's interesting. Tanja, it's been great having you on the program. I'd like to give you a minute or so if you'd like to kind of close and recap and leave our audience with a few takeaways and how they can get in touch with you.
Okay, sure. Thank you so much. I think it's exciting times right now in our industry, and the time is right to embrace this broader view of health. And really, at HealthFitness, we're all about creating healthy lifestyles. And we like to say we create healthy lifestyles by putting well-being into action, and we affectionately call that well-doing for more people. So we believe that by offering services to this broad view of health where it really resonates with others, we'll get higher engagement, not only in programs, but also in the company's workforce and being the best you can be. And finally, we'd love to have you check us out at healthfitness.com.
Yeah, thank you, Tanja, very much. Enjoy your weekend, and we really appreciate you spending time with us this morning. Great discussion.
Well, thank you. Thanks for having me. Take care.